Hi everyone, we're back, and the topic for discussion today is the new nurse, nursing communication skills, both verbal and non-verbal. And this will be done in two parts, parts 1 and parts 2. We all know that going into a hospital must be very anxiety ridden. A patient who's gotten a diagnosis or even had symptoms of something that has obviously gone wrong, that has affected their lives and probably will affect their family's life, and have to go into the hospital without a doubt, is extremely anxious and worried about what's going to go wrong when they get there. And it doesn't really help if you find yourself on arrival dealing with, let's say, a nurse or other staff who doesn't seem to want to communicate fully with you to ease some of those fears. So that's going to be our topic of discussion, as well as some situations which over the years nurses have related. First, we're going to talk about the nursing process. And the nursing process involves assessment, diagnosis, planning, implementation, and evaluation. We know that every patient who arrives in the hospital, whether through the ER directly to the unit, gets an assessment done. We know that the doctor also diagnoses, and then we do that nursing diagnosis where the plan of care, we implement whatever the doctor advises us to do. And of course, we know that there are many other people involved in this process. It's not just the nurse. You have people like the physical therapist, occupational therapist, there's the RN, there's the LVN, there might be the nursing assistant. It's called different names in different areas. Some people call them clinical partners. Different areas have different names, but they also have an important role to play. And we can go on and on about all the different departments, dietary, pharmacy, and we can go on and on about all the different people who get involved in the care of that patient. Ultimately, it all comes together for one perfect purpose: the recovery of that patient. Let's talk about nonverbal communication. Here's a patient on a ventilator. No doubt he's not going to be able to communicate his needs. Sometimes patients on a ventilator get agitated because they're in pain, their blood pressures go up, they cannot express what they're feeling. Sometimes the ventilator alarm starts to go off because something's disconnected, they're not getting enough oxygen, and they may need suctioning. Sometimes a mucus plug can get in the airway and cause quite a lot of problems. So we need to be aware, as people dealing with patients, how to deal with the non-verbal communication. Maybe you could, some places have like a board where you can have them point at things, or you can just express concern in a very compassionate way, which will be very helpful. But non-verbal communication obviously is a lot more difficult than but you can also explain in simple sentences to alleviate the fears of that patient. Now let's talk about a situation that happened with a nurse one day. This patient was delivered a baby from the maternity unit, and she was in distress. She was transported to the ICU. Her baby was kept in the nursery. Her husband followed her to ICU, and he was not aware of the situation, that ICU had different visiting hours. He did what normally happened on the maternity unit. They stay with their families, and the nurse just decided that she was going to just call the security to remove him. And that's the sort of thing where nice communication, good communication, could have avoided the problems that lay ahead. It was very disturbing. It left a lot of fears in that patient's mind. The family was very upset. Instead of enjoying their first child, there was so much confusion and so much explaining, and the family just did not trust the staff. So this is why it's so important for us as medical people to try to have good communication skills. One of the things I've found is that if we try to put ourselves in the position of that patient, we'd have a lot more compassion and empathy. I hope you've benefited in some way from this. Go to dearnurses.org, and there's tons of helpful information. I just thought I'd share with you Maslow's hierarchy, which is a very important part of nursing care planning. And this is sessions 39, which you can access on YouTube or going directly to dearnurses.org. Have a great day.